All right, everybody. So today we have Dr. Gary Linkov with us. How you doing, man?
Hey, doing great. Thank you. Thanks so much for having me on your podcast, Dave. Really appreciate it.
Absolutely, absolutely. So as we said before recording, every episode here starts with a donation to charity. I had mentioned my work with Operation Smile, and you actually mentioned that you had done some fundraising for them in med school. So we're gonna stick to that one today. As
Cool.
always, there will be a link to it below. And for people who are maybe just tuning in, that's an organization that helps children born with cleft lip and palate to get surgeries. And it's really not too expensive to get them to surgery, so it really helps out.
Yeah, it's fantastic.
So, Gary, I saw you on YouTube really actually pretty recently. And it was funny because I saw your channel, and your channel is a perfect example of how like the YouTube algorithm kind of works. Because I scrolled back a little bit and I saw that you had started with a podcast. And
Right.
I've seen other channels where they have certain types of videos, and podcasts by themselves, as I have found, are hard unless you are starting like Joe Rogan obviously has had it forever,
Yeah.
or like the Paul brothers, Logan Paul and Jake Paul, like where they already have a following. If it's just a podcast, I think YouTube's kind of a tough platform for that. But you recently started doing kind of like plastic surgeon reacts videos and things, which I think have really taken off. So
Right.
before we get into too much else, how like what made you have that transition? Was it something that you specifically wanted more YouTube growth, or there's something you wanted to talk about?
Yeah, it wasn't like really planned out, in any high level initially, honestly. It was just so it started off. So YouTube, for me, I think I started with a few videos back in fellowship to just like test it out. I did my own editing. They're
Hmm.
terrible, but they're still up there. People
Yeah.
can go and check those out. They're like 1 minute long, and it's like about perseverance and like
Okay.
how like doctors initially we're all kind of a little bit because people think that, oh, you go to medical school or dental school, that means you're not afraid of blood, and like it's really
Right.
not true. Initially we all kind of a little bit squeamish, and then you
Mm.
kind of get over it. So I made like a little short clip on that. So like really silly kind of basic things. I mean, I think that there's still kind of there's a lot of truth in them, but
Yeah.
I didn't know what I was doing. Right. So that was like my initial foray into YouTube. And then same thing. That's when like I started my Instagram account, like in fellowship, just to kind of test it out. And a lot of people were just kind of in the early stages at that time. This was, I guess, 2018. It seems like forever ago, but
Yeah.
it's only been 3 years. And then so then I started my practice, and I was getting some surgical footage, and I'm like, oh, like I want to make this into some clips. And also I'm like, oh, I need to make some informational videos. Like I just my whole thing was like, let's keep them short. And probably someone gave me that advice along the way, just to like, kind of encapsulate some of the things that I was doing surgically in the practice, and just to put it on the website so people can reference back, whatever. So we started with those types of videos, and it's funny because like I met my video editor at that time, and he was helping me with these little clips, and it really didn't have like too much value, but at the time, that's what I thought, what was all that YouTube was
Right.
for me. And then, COVID happened. So I had a few months off from the practice, and I took a step back, and I was like, what should I do to like increase growth, to like increase exposure? So I saw like a buddy of mine out in LA was doing this podcast interviewing people who he already knew, but he had like a bigger following, and he was a few years, ahead of me. So, his was maybe a little more interesting, but I'm like, look, I know a lot of people in kind of related specialties to what I do, a lot of great people. Like, let me just interview them. And so that's how I started like my little podcast thing. And it was mainly on Instagram Live, because I'm like, oh, it seems more authentic that way. And it
Right.
was kind of cool to see people's comments and try to respond to them in real
Mm.
time. And then I just connected back with that initial editor who I was working with, who I just discovered online. And I'm like, you know what, let's just put this stuff up on YouTube. Like, why not? Let's have the main clip, the full video, and then we'll just like break it up into different themes. And he's like, oh yeah, okay, sure, like let's do that. And then I don't know like who came up with this, if it was me or him, or but at some point we were like, well, let's just like try some other types of videos and see if that sticks. I don't really, I never, honestly, I didn't know anything about YouTube in terms of ad revenue. Like, I
Hmm.
kind of maybe vaguely knew that that existed, but I never saw it as a way to like make money, like
Right.
doing YouTube. I was like, well, I'm a surgeon, I have my home practice. Like, I need more surgeries, I need more patients in the door. I didn't really think that YouTube could help me get patients. I was just like, I don't know. I didn't really think too much of it. I didn't know that much about it. I didn't follow anyone really on YouTube. I didn't
Okay.
occasionally I'd go and Google, YouTube search something that I was, wanted to learn about, but not
Right.
like actively following anybody. And that was all fairly recent. I think it was only in October that we decided to like do something more on it.
Yeah, well,
And
that's and one of the comments I made was like, I was like, this channel is going to blow up because I could see, some people you can just see like the trajectory. And I guess maybe we should back up a little bit. We've referenced, your background here, but for people who don't know, so you're a plastic surgeon, right?
Right, yeah. So my background, medically is ear, nose, and throat, head and neck surgery. So my kind of core board certification is in that. So it's like basically everything involving like the clavicles up,
Hmm.
without doing too much with the eyes, and we don't do the brain, and dentistry is something
Right,
else.
right.
But everything else, we work on, and it's an interesting field, and I just always love the anatomy of it. I love being able to work with like with kids, with old people, like just the full range. I always thought it was really cool. So I went into that, and then I was always into art, and liked kind of creative, sort of critical thinking, and really enjoyed a lot of like the cosmetic and the reconstructive aspects of facial plastic surgery. So I'm a facial plastic surgeon. I don't do any body work. uh, you know, I do some hair work related to body, but that's kind of a different thing. And then during my fellowship, I had the opportunity to go and take a course in Miami with this one guy whose name is, kind of incidentally, Jeff Epstein, which is,
Okay.
nowadays not the most, it's kind of a notorious name, but he's a hair, the one in Miami is a hair transplant surgeon, a very good one. And he kind of took me under his wing and said, "Oh, do you want to like learn hair more?" I really enjoyed the course, and we kept in touch. And then after fellowship, I went and did kind of an apprenticeship and actually joined his practice, but with like a remote arm. Like I was his New York City arm, which was
Oh,
new for
okay.
him. It's not like people are like, "Oh, did he have practices in all these different states?" No, it was primarily Miami, and he had like a junior partner there in Miami, and then I was like his only other kind of junior partner. So that was really interesting, growing my practice while also trying to grow hair under him, and still kind of learning hair and doing hair with he
Yeah.
would fly his technicians to me in New York to do these cases. So it was an interesting start. That's how I got into like the whole hair world. And then I have my own autoimmune condition, so I ended up losing all my hair. So
Okay.
that's like the other crazy
Bad for
element to
business,
all
right?
this. Well, it's become like, I guess, a talking point on the YouTube channel. So
Right.
it definitely attracts attention because people are like, "Oh, who's this transplant surgeon without hair?" Like, well,
Right.
this is so stupid. But then as they learn a little bit more, they realize like, "Oh, this is kind of interesting." Like,
Yeah.
so whatever. That's kind of that whole thing. But yeah, so that's the work I do now. I also do some work for the VA, for the veterans. That's more reconstructive in nature. And a little bit some of my core ENT stuff I still do there. But my private practice in Manhattan is all about facial, mainly cosmetic work, surgical, some non-surgical stuff, but mostly surgical, and then the full breadth of like hair restoration. So everything from just people who are losing hair and they don't know what to do. They're not transplant candidates, but they need help with like medical therapy and other related things that really aren't surgical, to like really kind of more unusual kind of hair transplant surgeries, like eyebrow transplants, beard,
Wow.
pubic hair transplant, like things that others don't necessarily take on. But with under Epstein, like I learned all these different other sort of esoteric type of hair procedures. And so, yeah, other than just the usual scalp to scalp, I treat men, women, I mean, all different backgrounds. And then I do surgical hairline lowering surgery. So, kind of really all the different hair offerings. So that's what I do in my practice. And then, so in October, we decided to do these additional types of videos for YouTube just to see like what would happen. I mean, I like the audio was all off because I just used like the camera stuff. I didn't have any, my own, additional kind of gadgets or
Right.
accessories. The video, like I didn't know how to get the lighting right. Like it's just, there were so many things that were off, but people seem to kind of enjoy it. And I think like I'm kind of unique on YouTube in terms of my background. Just in general, there aren't too many people out there who like have like dove deep into facial plastics on the cosmetic end
Right.
and into the hair world, but like deep, not just like, oh, I offer hair transplants because I took a 2-day course and
Hmm.
bought a machine and import my technicians. That's not how I do things. So I only offer procedures that I can potentially get A+ results on. I outsource everything else. And there aren't too many people that, I guess, combination of skills who do this stuff on like a daily basis. And so, so in that sense, it's just a unique skill set for YouTube. And then, I mean, I think I can relate to people, and and kind of I give them like pretty factual things and my honest advice, not just like what's catchy in the field today.
Right.
And I back it up with like literature sometimes and just sound reasoning, and people I think have enjoyed that. And now we have like a whole lot of other videos lined up and ideas for the future to really grow beyond just what we're doing now. But I can share some of those ideas. But yeah, for now it's just like I'm still so backed up with like, because I've kind of attacked YouTube with like my lips work, a lot of lip surgery and
Hmm.
hair. But I mean, I do a ton of like rhinoplasty work, especially with veterans, and
Okay.
facelifts, eyelid surgery. So there's still so much, just kind of almost like kind of the basic content to
Yeah.
expose people to. And then there's
Right.
like all these things you can do with that, beyond just the content, the
For
main content.
sure. Yeah. I mean, like I said, I really think your channel is going to blow up. And when one
Thank
of the things I saw you talk about, you mentioned with Joe Rogan, but you've also referenced Derek from More Plates, More Dates. And it's funny, I see his channel as like kind of an in between the topics that, like I said, I've largely stuck with health and fitness, and yours is a lot of like the plastic surgery. And his channel, it's like, bodybuilding, but then he also gets into talking about hair transplant stuff. It's kind of like a nice blend there. And he and I actually have some other similarities as well, but I haven't talked to him directly. But looking at like what you talked about with, for you, I think a lot of people, unlike with dentistry, where you're talking generally speaking, like a 5 to 10 mile radius, maybe a little bit more, sometimes like 20 miles as far as people who will come to see you. With a
Yeah.
plastic surgeon, for something that, a hair transplant could be $10,000, $15,000. I mean, you probably will get people who will come from other states, even like far away, because they
Yeah.
want an A+ result. So it probably is even more amenable to YouTube and reaching out to other people.
Yeah, for sure. I mean, we've definitely had a lot of like inquiries because of the YouTube videos. So, that, and like, I almost feel a little guilty like making some like ad revenue, but
Hmm.
honestly, it helps me kind of pay my video editor. And the craziest thing is that we were joking around about this with him like, a year or more ago, just because I'm like, oh, I need like help here. I need someone to help me film things and not just like all the editing. And we were like, oh, maybe one day, because he lives in Serbia.
Oh, okay.
But literally, I was on the phone with him for like an hour today, we're trying to get him here to New York, to help me out. And so the
Wow.
logistics of that are challenging. So,
Yeah.
with visas and all that. So, but we're actually in talks. So, I think I can support him on like a full-time type of, basis. And the YouTube stuff, the revenue, I mean, it helps with that,
Yeah.
so, because I don't work with insurance companies, so it's
Okay.
all just, cash-based type stuff, and the expenses are high, obviously, in Manhattan. So, yeah, so, that kind of thing just helps kind of keep the system going. But we've had a lot of interest now from YouTube, especially for hair. And
I would
and
imagine.
even
Yeah.
my lip work, like people say, well, I found you here, but then I've been watching your videos. And nowadays we even will include the video to like people's post-op instructions. We'll be like, oh, and make sure you watch this video and like healing process after your lip lift surgery. And they like
Right.
it because they can always reference it. It's not just like something that's on a piece of paper that doesn't feel like alive. But I think the main reason why people reach out, because it's not like I have thousands and thousands of before and afters, for anything, right? Because my practice is 3.5 years old. Like, it's not,
Hmm.
I don't pretend, it's not like I'm 55 years old, right? So, but I think people, they realize I know like what I'm talking about, and they realize like I'm ethical in my approach, which is kind of like a really kind of high priority for me. And I think they feel like they can trust, in the fact that I'm going to make sure that we do things the right way for them. And I think that's the most powerful, message that I'm putting out there. as far as like people actually looking for a surgeon, because a lot of times, like even if you go to, quote unquote, the best, it's like you're just still seen as like a number. There's really no special attention given in many places. Some are, very just high level in all respects, but many places it's just like, you're just kind of a dollar amount, and
Sure.
you go in, you go out. No one really, especially the really established practices, even if they get a crappy result, like it doesn't really matter. I mean, their reputation's not really going to suffer after
Right.
they've built it up for so many years. So it's just a different level of attention. I try to give people like that really personalized attention. I make sure I only work with like the best instruments, the best people. So I think like folks realize that, even though they're like, okay, maybe he's like newer in the field. And I also, I don't charge an arm and a leg in relative terms for the work that I do compared to, other people in this town, and, and people like at the same level of quality, I would say,
Yeah.
worldwide, so yeah, so
I think
that's
some
how I
people would be
do
surprised to
converting.
find, because hair transplants, I believe, are one of the more expensive plastic surgeries out there. Obviously, some of the most common ones, rhinoplasty, breast augmentation, things like that. But I think, especially as far as the audience here, there are a lot of people who I find are interested in hair transplants or medical therapy. I mean, I have a number of friends who, I just turned 30, so we're getting to that age where you're starting to notice it. And
Right.
I have at least a handful of friends who are on finasteride. So that's like something I want to talk about as well, because I know a lot of people recommend, okay, medical therapy, the general recommendation seems to be starting with finasteride, seeing how you do with that, maybe minoxidil, or what a lot of people think of as Rogaine. And
Yeah.
it seems that most of the studies like suggest that it's relatively safe. And I know that's kind of the standard recommendation. Me being the hypochondriac that I am, I am always just like wary of things. I know some, very occasional reports of post finasteride syndrome. If so, maybe we get your opinion on that. So do you think I'm totally crazy worrying about it, or you think most people would be totally fine with it?
Not totally crazy, but like so the patient perspective is always different from like the doctor's perspective. But then
Mm-hmm.
I try to put myself into the shoes of someone with male pattern loss and like, what would I do, type of thing, based on what I know. And I can tell you that in terms of surgery, in general, surgery is not just plastic surgery, but in general, I'm a little apprehensive kind of looking at it from my, because it's just, you have to have a tolerance for risk when you're
Mm-hmm.
going under. And this is not answering your question exactly, but that's why, like, for my family members, I'm always just very cautious about them. Like my mom, when I was leaving, like I told you earlier, I was at their house today, and she's like, oh, I got to do something about this. And like knowing my mom, and like just how, just she's just like, she'd be the most impossible patient. And
Yeah, right.
and really, like, she has like zero tolerance for any risk. So if
Mhm.
anything goes wrong in any, fashion, she'll just be so devastated
Yeah.
and freaked out. And I mean, that's not someone who should, have surgery. So it's higher risk, but potential for higher reward. That's how I just think about surgery in general, but especially cosmetic surgery that you don't really need, right? Like,
Right.
you want it, you don't really need it. And so it's like, that's an important consideration. So now with medical therapies, again, especially for cosmetic purposes, you have to really weigh that out. Um, Most doctors at hair clinics will push patients to do, finasteride or the brand name Propecia. Usually Propecia first, if possible, even though it's more expensive,
Hmm.
because it's more reliable just in terms of the composition. Uh,
Compared to a generic,
yeah,
or
generic sometimes, and depending on which lab it's coming from, it's just not always the same, again, quality,
mm,
and can affect the results. So usually we recommend starting with Propecia for 6 months, if possible. Some people don't want to pay for it or whatever, but that's always sort of a better route. And then seeing and transitioning to finance. But yeah, so from a hair clinic perspective, when you review all the literature, I mean, it's generally very safe, and any side effects that occur are like 99% reversible. So yes, maybe there's some very small chance of something being permanent, but most of those cases in the literature are because of some other comorbidities that have
right.
resulted in persistent ED or whatever the issue may have been. So if it were me, like, that's how I would approach it. I would go on it if I were committed to keeping the hair that I had. I mean, someone might decide like I'm okay being bald, and I'm totally for that. As I've kind of had to deal with my own issues with autoimmunity. I mean,
Right.
it's like I don't really have too much of a choice, even though I do have a choice. I can take a JAK inhibitor and it probably would restore some of my, hair loss, but I don't really want to deal with those side effects. But that's a stronger immunosuppressive medication.
Sure.
But that's like a conscious decision that I've made for myself, especially, having my issues in the time of like COVID and,
Right.
and I don't want to suppress my immune system. But yeah, and I guess I'm like, I've accepted it. Like I'm more or less okay, and doing certain things like immunotherapy, allergy shots, which is not accepted practice, but something that just kind of understanding some of the underlying mechanisms of allergy and autoimmune conditions, made sense to me to try, and I think it's been helping at least in
Yeah.
part. Whatever. So so I think for certain situations where you have younger people who are starting to see signs of thinning, recession, and they're really committed to trying to keep their hair and open to potential transplants or really trying to avoid a transplant, Propecia is just it's the highest like rate of efficacy, that we have as far as medical therapy. Some folks ask me, well, what about PRP? Like, can't I just go and just keep getting the PRP?
Hmm.
Yes, I see it as like a boost and definitely an improvement for sure. But still doesn't really rival the impact of Propecia for the
Can you tell
majority.
people what PRP is?
It's platelet-rich plasma. It's taking your blood's plasma, platelets from the plasma. So basically, drawing the blood, spinning it down in a special machine called a centrifuge, taking the platelet-like component of the blood, like you don't need the red blood cells, taking just the platelets and re-injecting them into the scalp. The platelets have growth factors that are released, and temporarily they help sort of boost the kind of local follicle milieu and give them more growth factors to thrive on. But eventually they get used up, and it's variable, how quickly that happens, and they have to be replenished. So it's not something that you just get once
Right.
and you're done.
And it's
So I
fairly
don't
expensive,
see.
right? Isn't it like a
Well,
couple
yeah,
grand?
yeah. I mean, you have to. Yeah, I mean, I can tell you, my practice for me to do it, we charge $1,500 a session. We
Hmm.
use a really good system, but that's a whole other kind of discussion. And then for my nurse to do it, my like specific hair nurse, it's $900 a session. But yeah, you have to do it like several times a year
Yeah.
if you want to maintain it. So it's not cheap. Um, there are alternatives like laser light caps. There's vitamins, biotin, basic Nutrafol. I mean, all those are fine, but you're not going to see as consistent of a gain as with finasteride. It's
Sure.
just minoxidil is also in that kind of category of like giving results, but they're just not terribly
Hmm.
impressive. A lot of us in the hair world have been switching over to oral minoxidil over the topical and seeing better
Really?
results, and also kind of still very safe because the doses are much lower than doses used for like any blood pressure control, which is kind of what the
Okay.
medication was originally intended for. But
Yeah,
it
I was
was
going to say I was
discovered
under
in
the
the 90s.
impression minoxidil had some significant systemic side effects if taken orally, but maybe, like you said, the dose is
Not at the
different.
low doses, yeah. So you don't need like high doses for it to work on follicles, and
Hmm.
yet, it's still very safe
Hmm.
for hemodynamics. Yeah, it was discovered as like an IV agent, in the ICUs. Someone made the observation that hey, people getting this blood pressure agent or control agent, like they were their hair was coming back,
Hmm.
and so then eventually it was tested as more of a topical type of solution, and that worked. But I can just tell you, just from like clinical experience and people's feedback, they don't love it. I mean, it's
Yeah.
the initial period a lot of people shed, and just the foam or the solution, it just kind of gets a little bit onerous to apply, and just people just not the best things to say about it. But I know that still works. I mean, it's been clinically proven to work. But a lot of people do very well in the oral minoxidil, especially those who just refuse to take finasteride or they've actually developed side effects. If you're 45 and you have, some thinning, it's a consideration to say, well, maybe I just want to transplant. If things are overall, they've been stable over, a long period of time, then maybe consider avoiding starting finasteride at that age. But people in their, late teens, 20s, 30s, I mean, it's tough, because then if you just do a transplant and you start to lose the rest of your hair in that kind of sensitive zone, it's not good, and then it's very hard to kind of match that pre-existing original density at that rate.
As far as like transplants, what's the youngest you've had somebody get a transplant?
In my practice, 22. But I mean, there are some people in their late teenage years that are a Norwood 6, 7. I mean,
Wow.
there are some really accelerated cases that, are potential transplant candidates, but you just don't want to be, I have a whole video on this. You don't want to be lowering people's hairlines at a
Right.
young age, especially for guys primarily. Because, I do these hairline lowering for women, and people are like, oh, like, you see, and you said you shouldn't do that. Like, no, I'm talking about like young men primarily. Even a guy who's older, like even like late 30s, you can consider some degree of lowering, depending on their hair. But like guys in their early 20s, which is a lot of the requests that I get, like, no, you shouldn't lower it by an inch. It's ridiculous, because you just don't know where they're going with their pattern. And then if they have like a super dense area here, and then this all starts to go,
Right.
it's just a terrible look.
Right. Because you're limited. So maybe people who don't know this, you're limited to a certain number of donors, right? And so when you run out, at least my understanding is the technology we have today is you're just kind of done. And then you're kind of stuck, right? For the most part.
Yeah, for the most part, it's true. We then go into the neck area and pull from there, and sometimes into the chest and back if they have hair there. But arms and legs, the hair is too thin. People ask me about like pubic hair to the scalp. Not ideal. The regrowth rate is much lower. So it's not just the texture that's kind of off, but also the regrowth rate. So the neck has the second highest regrowth rate after scalp hair, and then chest and back would be sort of your next best option, third best option. So it's not just the texture or how much of something you have. It's also the potential for it to actually grow in the new location. That's like kind of revision type of work for people who, yeah, they've gone through their entire supply and they look super thin back here, and there's not much more you can take. So yes, there's a limit, and you need to be cognizant of that. And so that's the problem with starting too low, because then you have to have enough hair to build.
Right.
And that's also why I don't love starting with a big procedure on the crown. When I see signs of loss towards the front, but there's still, a decent amount of hair, and then especially in a younger guy, and then like there's like almost nothing on the crown, you got to be super careful, because if you dump a lot of hairs into that crown and you're using sort of your best hairs on the crown, but then they can thin out here, then you just don't have enough for the more important part, which is like front and mid scalp. So that's another scenario. We just have to be super careful and plan. So the regrowth kind of percentage is lower. So for scalp, you're looking at about 90%. For the neck hair, it's about like 70 to 85. And then for chest and back, it's closer to like 60 to 70% of regrowth. So that's the first issue. Second issue is like, yeah, the texture and the quality of the hair. Most of the time, like if you give it enough time, sometimes it can take years. The texture actually kind of accommodates and becomes a little bit closer to the place where you put the hair.
Wow.
So that's something really interesting that occurs. So it can be a little bit wiry for a while, and then it almost like corrects itself most of the time, but it can take years. So there are a couple of elements there. So, and then where to place that hair, it's better to kind of focus that more on the crown, where it matters a little bit less than at the hairline. So hairline, you really want to use your scalp hair.
Is that more expensive, or like, because I know a lot of times if you're doing like FUE versus FUT, generally I know FUE is like kind of like the spots, and then FUT,
Yeah,
you're taking that big kind of splice there.
exactly.
But my understanding is it's per follicle that it's charged, right? Like a lot of people say it's, $5 a follicle or $10 a follicle. Is that the same for taking it from chest or back?
Usually for body work, we charge a little bit more, but on the order of like a dollar per graft more. Not,
Okay.
not a ton more, but yeah, because it's just technically more challenging and it takes longer, So our team is, working harder. They're there longer. So that's where the additional fee comes in. But yeah, you're right. It's usually per graft. Some places charge per case, regardless of how many grafts.
Oh,
And it's another
really?
way to do it. It's kind of like akin to like botox. Like some places charge by the unit and some charge just by the area.
Right.
So it's kind of like that. I generally charge by the area, but for hair procedures, I still do per graft. That's just kind of how I was trained, and I've kind of stuck with that.
Gotcha. Okay. So big question. Does it bother you that as a dentist, I have taken courses and will do Botox and fillers?
No, it's so commonplace
Yeah.
that look. I mean, the alternative, one of the alternatives, is for people just to do it themselves, which
Right.
there's a growing community online
Really?
for that, and I'm pretty anti that, especially when it comes to filler, just because of the higher risk.
Mhm.
So, if you have a doctor who's, gone through some courses and understands risks and benefits and kind of general techniques, it's just, I'm just so used to hearing about it. It doesn't, I
Right.
wouldn't say it bothers me. It's just like, yeah, like I have one of my good friends in town is a cosmetic dentist and he does, Botox filler. But then when it gets a little more complicated and he's not sure, he'll
Sends it
send them
your
to
way.
me. Yeah, which is
Yeah.
great. Whatever, so yeah, I just think that you shouldn't do it yourself.
Yeah.
That's really what it
Well, I
comes
would
down.
definitely say I am surprised because I took a course, but you could actually, I'm shocked by how minimally you can educate yourself on it and be allowed to do it because I did want to make sure that, and with a lot of the things I do, it's not like, even when I look at what I learned in like dental school residency, like I feel like I had to educate myself beyond that. And certainly, like I was part of the American Academy of Facial Aesthetics and there were things that I wanted to learn more of. But the fact that you actually can just take like a 4 hour course and now you can do it, I would say that's very questionable. And you should maybe either ask for before and afters, figure out the training somebody's done, because I think it's a little bit too lax in terms of the requirements personally.
Yeah, I agree. I agree. Yeah, I mean, you have some like extremists, on the other end, like certain dermatologists that I've met where they're like, unless you're a dermatologist, a plastic surgeon, or pretty much that's it. Like, no one else should inject.
Hmm.
I don't really subscribe to that. But I agree with you. I mean, you have to kind of go through the right training and all of that. But what does that mean exactly, and where the regulations, fall? It's kind of unclear. There's a lot of, kind of gray area, and a lot of like the risks and complications, like they're usually somewhat more rare. The really bad things are pretty rare, which is good.
Hmm.
And then I think that when they occur, they're sort of swept under the rug.
Yeah.
Oftentimes that's not what you're seeing on the Instagram feed.
Right.
And
Right.
so people just see all these kind of great, usually immediate post-op results, like,
Right.
right after they're all swollen up and everything's glistening and beautiful. They don't show the bruises the next day,
Hmm.
um, or the bumps that form, a couple of days after. So yeah, so like everyone's seeing these perfect results, and that's what they're expecting, and they're not really thinking about the things that can go wrong.
For sure.
And then yeah, and it's scary to me that like some people injecting like don't even know what those risks are. I mean,
Yeah.
that's the scariest thing, because then you don't know what they are, you won't know how to pick up on them. And a lot of these things, you can save the skin from vascular occlusion if that were to occur, like by just having the right stuff around, like
Yeah.
Hyleneck, injecting enough of it and knowing where to inject and what territory may have been affected. So, if someone has no idea about any of that, it's kind of frightening. It's just like it's crappy patient care.
For
But as
sure.
long as people understand that, understand where their comfort lies. I mean, there are certain things that I won't do with filler that plenty of people with a lot less training than me, do.
Yeah.
But the reason is because I'm scared of those areas, because I know what the data shows. I've seen some of the complications, and they're frightening when they occur. So for example, I don't inject the glabella with filler.
Mhm.
I don't inject the side wall of the nose with filler. And I almost never inject the tip of the nose with filler either, because the vasculature is more unpredictable,
Right.
and the complication risks are just higher. So, but then you have plenty of like med spas where the nurses are injecting wherever the hell, someone
Right.
wants filler. So it's just Botox in general is a lot safer.
Yeah.
But with filler, you just got to be so careful.
Yeah, no, I mean, you hear some horror stories with filler.
Yeah,
You hit the wrong vessel, it goes to the eye, and like you said, there's necrotic due to the vasculature of the tip of the
right,
nose there.
right.
So I do think people have to be wary about that.
Yeah,
Um,
for
do
sure.
you find that, because obviously, as you said, with plastic surgery, it's almost never necessary. I mean, certainly if somebody got in an accident or something like that, but for the
Yeah.
most part, people don't need it. And I would say in the world of lifting and bodybuilding, you do get a lot of people who they have a body dysmorphia and they kind of don't know when to stop. Do you find any crossover there where you get people who are super obsessed with their physique and their fitness and stuff, and they're also super obsessed with their facial appearance, and maybe you even have to talk some of them down from getting so much done?
Yeah, yeah, for sure. I mean, it's a great question. Yeah, no, definitely. My background with like undergrad and all that is psychology, and I think it
Mm.
it really is super applicable to this field. I think unless you are somewhat interested in like human psychology and what drives people, I don't think you can do this line of work, because on one hand, I have to be able and willing to see some of the nuances of what people, are coming to me with, because that's like my job. Like, something small on the nose, like a little bit of a deviation or a little, kind of protrusion, it probably doesn't bother 99% of people just in the world, but it bothers the rest of people, and I need to be able to see it, right? Uh, there are times when someone comes to me with a specific complaint and I just don't see it. And I know that I'm good at seeing things. So if I
Mm.
don't see it, um, then that's a problem. And then I can't operate on them unless I'm able to kind of like agree with them on a plan. And if I don't see what they're talking about, there's no agreeing on a plan. So, I refer them elsewhere. Um, so there's that type of situation. There's a situation, like you said, where people just keep coming in for more and more surgery. And I do see that play out in my practice. And I do my very best to kind of like put a stop to it. Um, but you have to be careful also not to piss people off, and really, and you have to stand by your work. So if there was maybe something that didn't come out the way the person imagined it, or if there's something you can improve on surgically, we'll offer a revision procedure, usually at cost, and kind of try to just make it even better for them. But I have definitely seen some people where, they just keep coming back, and I'm like, there's a limit to how much better this is going to get.
Right.
And so you just kind of need to stop. And then there are people who love the results of one surgery, and they're like, oh, I want to do this with you, and then I want to do this with you, and you have to be careful of that as well. But sometimes it's valid. Like, they start with
Right.
something small because they don't know, like, they don't know if they can fully trust you. They don't want to pay a lot of money, so they start with a smaller procedure, and then they're like, oh well, my whole face is sagging actually, and they
Yeah.
they might not be wrong. And then it's like, all right, well, let's talk about a bigger procedure to address these other concerns. So it's tough. I mean, I've kind of been um, mistaken in both directions before. I've had situations where I thought like I judged the person pretty well in that regard. I'm always thinking about that every consultation. Like, is the person realistic? Are they kind of doing this for the right reasons? Which becomes very subjective, but I need to kind of keep my antenna up for things like that. And I've had times when like everything seems fine. They seem totally reasonable. They've never had plastic surgery. There's just one thing that bothers them, and we're just trying to fix it. We fix it, or we improve on it, and they're not happy. They're not happy even though it's been improved. And it's kind of like, well, why aren't you happy? And then you start to realize it's kind of opened up a whole other can of worms. They don't like their physique, they don't like other things about themselves, and they start to talk about it, and but yet they're telling you that you needed to improve the surgery that you did, and you're like,
Right.
whoa, this is much deeper, you know, this goes
Totally.
much deeper, and like it's not something that I'm going to be able to really help you with. And that becomes a difficult conversation after they've paid you money, you know, for a surgery. And then I've had times when like someone just kind of seems off, like just you just get those vibes, like, you know, you probably just shouldn't touch this person. And yet they keep coming back and they keep saying like, no, 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 you're the doctor for me, blah, blah, blah. Like, you know, I researched you. And you kind of then reconsider it and decide, you know what, like, okay, maybe they're being reasonable enough and let's just do the surgery. And then they're like, you know, happiest patient, never bother me again with any other complaints. They're just like super content. I don't know what ends up happening to them, like if they're not in my practice, but they're happy with the work I've done. Maybe they go
Right.
on to other things and do other things. But I've had times like that where someone just seems like kind of off. I don't really vibe with them, and yet, you know, we still do the surgery and everything ends up great. So
Yeah.
I don't know, you know, it's just it's very hard because you want to pick out the people who are just not good for the practice and just it's not the right thing for them. Like they have other problems, but then referring them to a psychiatrist or a psychologist is super hairy kind of territory.
Yeah.
And it's I've only done that on like very few occasions when they're telling me that they're suicidal and
Oh,
you know
wow.
other things. I mean that's come up, and obviously those patients I just you know gently push them in a different direction.
Yeah.
So but that's pretty rare, you
Yeah.
know. And
And
so
it's
then if I just
interesting.
don't feel
Well, I've had a few patients now who like very big cases where some, oftentimes women, but sometimes men, like bulimia patients where like years and years their teeth are just completely eroded. Like these patients don't smile. And in the one sense, it's awesome because these are genuinely like life-changing, you know, procedures for these people. You know, one of the videos actually I have on my Instagram is a girl who, you know, she's like crying, her mom's crying. It was really nice to see. But a lot of times, not in that particular case, but a lot of times these women, they have other issues going on, you know, and then when that's done, they ask for, you know, now it's the fillers and the Botox. And like you said, it's not always that that's a problem, not at all, but it is, you do see certain patterns. And sometimes it's hard to know. And one of the things that I think is difficult is I'll have patients who come in and, you know, it's hard to be objective here, but let's say their smile was a 4 out of 10, right? And you take it to an 8 out of 10, and they're so happy, right? They're just ecstatic. And
right.
then you get the patients who come in and they're at a 9 out of 10 and they want a 10 out of 10. And that can be pretty tough, you know, and
Yeah.
they'll say, I want to look like this person. And it's like, you might not be able to look like that person, and kind of going through all that with them.
Totally. Yeah, I agree with you, Dave. Yeah, you're right. I definitely know exactly the type of scenario you're talking about, where someone's coming in, they're essentially like already an A, and they're trying to get to the A plus, and it's just you have like such little room for improvement, and yet with any procedure, there's always that risk of something, you know, not going well, getting an infection, which leads to worse healing, or something pretty rare. So yeah, I mean, those are really tough cases. Um, but yeah, so I definitely like it when there's more of a delta.
Yeah,
Uh,
right.
you know, yeah, I just actually I've been getting the some of the more recent facelift patients that I've gotten and actually have coming up. They're like they honestly look pretty good as
Yeah.
is. They're not like everything sagging type of situation, and I'm like waiting for those to come in because I'm like those are the people who really
Be helped.
tremendously benefit, you know, from these types of procedures. But you know, I mean, they'll come around eventually. But yeah, no, that's a really good point. Yeah, sometimes people just you know they're starting in a different place, and you're doing the same like type of surgery or procedure for them. But the starting point is totally different. And then the other point to make, and this I don't know. I mean, some people might take issue with this, but it's just kind of the way it is that when we post, you know, before and afters, and the person at baseline is just kind of, you know, somewhat of a more attractive person,
Hmm.
the numbers of likes and whatever comments are always higher than if
Sure.
someone just maybe isn't the most attractive person, and yet you did the same surgery, they
Right.
got the same degree of gain, but they're still not. I mean, you can't change everything,
Mhm.
nor should you, and that just gets a lot less attention. So I always hope in those situations that the person who got the surgery, who received the change, is just happy enough with those changes, because that's a part of it.
Yeah, no, I mean it's really, and that's a big reason that I want to talk to you, because I think there are those similarities between, and not to say like obviously I think everybody should live a healthy lifestyle, work out, exercise, things like
Yeah.
that, but you definitely see some similarities between the influence that social media and TV and all these things have on people, and it's like it's never good enough, and people who are in the quote unquote real world might already be an A. They feel like a C minus relative to like Instagram, and it really can develop some bad psychology there.
Yeah, I mean, I think it's all about just like loving yourself and being, kind of comfortable in your own shoes. But now some people, and that's why like I get these comments sometimes on YouTube, like, oh, plastic surgery, it should only be for like reconstruction, all this cosmetic stuff is, BS, and you shouldn't do it. Um, I think it's a very narrow mindset,
Mm-hmm.
because it's just same thing. Like, why do people see therapists or seek out help for anything? I mean, it's not everyone goes through life just super confident in themselves all the
Right.
time at every stage, and is just able to power through all of what life kind of throws at you. And so it's very similar with like physical things too.
Yeah.
So most of my patients are extremely normal, like grateful people who have like a specific thing that bothers them, whether it develops with the aging process, or they had a prior injury, or they were just born a certain way and it just makes them stand out, or just bothers them specifically. And they're just looking to kind of make that change or that improvement. And then they're super happy. I mean, the satisfaction rate for pretty much all the surgeries that I do, I mean, they're very high. But
Yeah.
of course, you get people that even like, and that's the hardest situation, I think, because sometimes, surgery doesn't go exactly as planned. It's surgery. And, I'm like, oh, yeah, maybe that could be improved. And the patient agrees. And, we plan to essentially redo it. I mean, that comes up, not often, but it does. But then the hardest thing is when I like the result. I think the person really looks better. It's exactly what they wanted, what we talked about, and they hate it.
Mm.
Again, rare type of scenario, but it comes up, and it's super hard to deal with, because then they're wanting me to do something more for them, and I'm like, there's nothing more for me to do. I mean,
Right.
this is really good. Like, sometimes I'll ask them to get a second opinion, but then they feel like you're just kind of trying to,
Brush them
I don't
off or
know,
something.
push them off or be defensive. And I'm like, no, like it just, so things like that. And then sometimes I'm like, well, maybe the scar could look a little better, and the person's thrilled,
Yeah.
and then
Yeah.
also
Right.
just because, and my buddy who's a rhinoplasty surgeon in town just recently told me, he's showing me pictures of a rhino he did, and he used rib cartilage. It was advanced. It was like a complex revision rhino, and like from a profile view, it looks perfect, but
Mm.
from a frontal view, there's a slight deviation to the tip.
Yeah.
The patient is ecstatic compared to what he had before,
Mm.
loves it. Like, my buddy is just like, what can I like? Like, he wants to bring him back to the OR to make
Yeah.
the change more for himself than for the. He's like, I know it's not like ethical, but
Yeah.
but I mean, there is that tendency, because we're like perfectionists. I mean, in
Sure.
this kind of work, and in what you do too, and it's just kind of
Well,
like,
you're making me think of like a recent case. I had that where, and it was tough because when you're doing like veneers or something, you put them on, you don't cement them, you make sure the patient likes them. And in this case, I did not say it because the patient loved them. And I saw something that was like a little off. But she loved it. So then we cemented it. And
yeah.
then she said,
Then you
I
notice,
don't know. So I'm like, awesome, great. So we did redo it for her because like I said, I saw it, but I was like, it would have been a little easier if you said it beforehand.
yeah, that's true. Yeah, no, that's a really good point. Yeah, no, I think nowadays, like when I see it, I'll usually call it up, but then yeah, there are times when I hold back, because
Yeah,
if the person's really happy, because you don't want to create an extra complex for them,
totally.
or put more doubt, because the whole, like, all these procedures, I mean, it's a lot for the person to deal with. I got worked up recently. I had a patient come in, a week out after lip lift surgery, looking totally appropriate for that time point. A little
Hmm.
bruising, swollen, incision line looked very good. I mean, no issues. And she came in, and she flew in from Kentucky for the surgery, and was in town for a week for me to then remove the sutures. So comes in for suture removal. And during that week, a couple of times I just messaged her, "Are you okay? Everything good?" "Yeah, yeah, everything." Comes in like clearly distraught, and I'm like, "You seem like," I told her, I just call it out, I'm like, "You seem like just very like terrified of something. Like, is everything okay?" And she's like, "Oh, well, I was out to dinner with a friend of mine who I guess her friend lives here or whatever. And my friend just looked at me and said that she thinks I was botched, and that that I need to get a second opinion." And I'm like, "What?" Like, I'm like, people fly to me for this surgery. It's like one surgery that I mean, I write articles and literature about. Like, I know it really, really well, and I do it like about 5 times a week these days. And if there's an issue, I'll be the first to tell the patient that, hey, something's not going well here, But she looked perfectly fine for 1 week, So I couldn't hold back like my emotions. So I told her, I'm like, "Your friend was way out of line. Like, this is, your healing is completely appropriate for this time point." And I just called out her friend. I'm like, "I'm
Yeah,
not sure what kind of friend that is,"
yeah.
because
Wow, I'm surprised they would
because
say that. Yeah.
in recovery, it's a very sensitive time for people, and if in our facelift literature, there are like documented high rates of depression in patients as they're recovering, because they went in trying to look prettier, and now they're all bruised up, swollen,
Hmm.
things are pulled up, and they're just trying to kind of cope with the recovery. So lip lift surgery on a smaller scale is kind of still like that. So for someone to come in and just kind of kick you in a way when you're down and recovering,
Yeah.
it's horrible. So I got all worked up for myself, because you don't want to hear those kinds of words
Hmm.
spoken about you, especially when because it's just totally irrelevant. But also because that's like so unfair for my patient to hear that.
Yeah.
And so yeah, but
Yeah.
whatever that
Well,
happened.
what you said before about and again, it's a middle ground here, right? You're going to have patients who are, perfectly like psychologically sound and people who do have issues. But I think it's naive to think like, for somebody who says, "Oh, like nobody needs to do any of this." It's the same reason that, like we said, going to the gym and wanting to have a better body or physique. It's naive to think that how you look doesn't matter in this world. Like it absolutely does.
Correct.
And whether you want it to, even if you're perfectly okay with how you look, like
Yeah.
the, I guess, unfortunate or fortunate reality is people absolutely treat people differently based
Yeah.
on a lot of things, status and how they look is certainly one of them. But also, I remember I've seen, I'm sure you're way more familiar with the literature than I am, but I've seen papers showing increased levels of happiness after plastic surgery.
And successfulness too.
Yeah.
Lisa Ishii out of Johns Hopkins writes about this and has published on different types of surgery. She's facial plastics as well, so she's got articles on hair transplant, actually,
Hmm.
on rhinoplasty and facelift surgery, and I'm sure many others. But she looks at those metrics on not just how someone's judged in terms of do they look like better, but how successful they are too, and a few other metrics,
Hmm.
and they all go up essentially with sound good surgery. So yeah, so I mean, exactly to your point, it's very, very real. And some people, I guess, are just super comfortable in their shoes. They don't really think about what others think of them, and yet it might still be impacting them,
Right.
and they may not even know that. So it's super naive and kind of ignorant, and not really seeing the big picture. um, but again, it's not like I don't feel like people need these things. I just feel that there are plenty of people that are helped by these types of procedures when they're properly selected for the right surgeries, and when those surgeries are done correctly. I mean, there are different ways to do surgeries, but there are certain, quote unquote, wrong ways too. So there are different right ways, but there are some wrong ways. So, choosing the right technique, choosing the right suture material, I mean, all those things play a role.
Absolutely. So, last thing I wanted to ask you about, are you familiar, well, I'm sure you've at least heard of Kybella?
Yeah. Mm-hmm. Yeah.
And so, I see this indicated for people basically getting rid of fat, like the mental fat pad here. It's funny because I had heard about that, and then I started seeing people again in like the kind of underground fitness world say, well, it gets rid of fat there. Let's put it other places.
Mm-hmm.
And I don't know your opinion of it. I looked into it just a little bit, and my understanding is it's just deoxycholic acid. And I could be extrapolating way too far here, but the studies I've seen suggest that deoxycholic acid correlates strongly with colon cancer. And if they put it in the feed of like mice and stuff like that, it will cause more colon cancer. So, but I've seen no indication of that as far as actually applying it in patients or anything. So, I'm not that informed on it, and just wondered your thoughts.
Yeah, I don't think that that's been correlated for like the FDA approved indications for, Kybella or deoxycholic acid. Now, if you're injecting it in different places, could that potentially, especially in high doses, play a role with colon? Maybe. Deoxycholic acid, and I'm not a expert exactly in all the workings with the intestines and where, but I mean
Sure.
it is in, I think it's in the either in the stomach or the small intestine. I mean, where it's breaking down, food, it like, breaks
Right.
down fats in food. And so maybe at higher concentrations, you can imagine maybe it could be harmful for the inner lining and lead to maybe some colon. That's my only kind of train of thought on that. But in terms of like these other types of applications of deoxycholic acid, and could that then increase your chance? I have no idea. I don't necessarily think that that's been studied well.
Yeah.
But yeah, who knows? I mean, maybe there's some truth to that. But yeah, even as far as it goes in here in the submental region, I'm not a fan of it. Partly because it's expensive, so you need
Mhm.
like several doses
Right.
many months apart. People get significant swelling, much more than liposuction,
Mhm.
after the injections, just from the severe kind of inflammation. It's harder to control because
Right.
it's just like, you're putting it in these different spots, but the exact spread of the liquid, it's just a little bit harder to control. So my preference, and then other options for that region would be like cool sculpting,
Mhm.
or which is like freezing the fat away, or liposuction. And I'm definitely more of a liposuction guy because I can really control where that cannula is going, how much fat is being removed there, and I think it's overall not any really more expensive than getting multiple sets of injections, and it's kind of a one and done thing,
Right.
and the recovery is definitely not worse than Kybella. And I think it's actually less painful because we numb up the whole area with lidocaine, and then I put a
Mhm.
tumescent solution in with Marcaine. It's pretty comfortable. So yeah, that's my go-to. And what I always tell people, just since we're on the subject, is that it's only going to address the subcutaneous fat. And so the degree of improvement, I quote usually about 20-30% tops for people,
Yeah.
because I just don't want them to go in with like high expectations. They're not going to get a recreated, super acute angle,
Mhm.
cervical mental angle. The only way to do that is with deep neck surgery, which I offer, but it's like a much bigger process, more risk, more downtime, more expensive, general anesthesia, drains afterwards for a few days. I mean,
Wow.
it's a real process. That's the only way to really recreate an acute angle in people. So I just kind of let people know that subcutaneous fat is just a portion of what is sort of like manifesting as like a full neck. And sometimes in older people, it's laxity as everything is dropping down. So there's a lot of skin laxity. But in younger people with like a heavier neck, it's a lot of that deep, like deep fat, deep muscle, you know, beyond the platysma. So whatever, maybe it's going off topic, but
No,
that's
I mean, I think it's super interesting. And, you know, maybe we can get you back on to talk specifics of that. But yeah, there's a lot. I've seen people get buccal fat pad removal, right? And
yeah, I got some
there's,
thoughts on that too.
I generally don't recommend it. Sounds like you probably agree.
No, you know, I started my practice doing it, even though I didn't have like a ton of exposure to it in my training, just, you know, by the nature of just where I trained, they weren't doing a ton of that, but I saw some of it. And I didn't enjoy doing the surgery. And then I started asking around, and a lot of the senior guys, at least in my field, don't offer it. And it's for good reasons. And there's been many studies on it. It's actually the type of fat that generally does not resorb or atrophy with time. So later on, when our faces kind of thin out,
right, look more age.
yeah, that fat actually keeps you from, in most cases, unless it prolapses. I mean, there are some unique situations, but most of the time, that actually is going to keep you from looking too sunken in. So you get it early in life, you're going to regret it later on. That's A. B, there are some important nerves around there, branches of the facial nerve, and they can get dinged. I've done that once. Luckily, it came back. It's usually temporary, but still, that's not fun. 3, it's not a very comfortable procedure to go through under local anesthesia, which is how it's usually done. Because you can numb up, as you know, like the buccal mucosa, but then the deeper stuff, you can't numb it up. And so you're digging in there for that fat, and it's uncomfortable for patients. And it's like, it's easy to overshoot and then again make it too sunken, and it's also easy to go in there and like not really dig out anything and just search around and then come out pretty much empty-handed, or get something that you want. You force yourself to believe that it's the buccal fat,
right?
You never even reached it, or just didn't find it. So and then you have to try to do the same exact thing on the other side.
Yeah, I think it could be a mess for sure. I mean, I've seen some before and afters of people who, and maybe somebody who like, okay, you got like I've seen a lot of like Asian descent women where thin body, but just really full faces. And then I'll see them get pretty good improvement. But even then, you know, I think a lot of these before and afters, they have other facial liposuction going on and things. And it's like you said, the risks there, and, you know, the nerves and arteries there, there's a lot of potential complications.
Yeah, so I tried it, had a few situations that I just was not happy with, and said, you know what, I'm just not going to offer that anymore. And I just stopped, you know, and it was tough because, like, you know, you're starting out, and I actually had a few results like posted online, so people were contacting us about this procedure. And I was just like, I had this, it was the only procedure where I would go in and just feel like, I just would just feel so anxious about it, because I was like, well, what if I get the fat pad on one side and don't get it on the other side? And then just that digging around component of it, and like knowing that the patient's uncomfortable, just like kind of killed me. And I'm like, I don't like that feeling, the feeling that I had, you know, going into surgery. So I said, it's just, for so many reasons, I'm just not going to offer. And we still get people calling, and we just tell them, you know, we don't do that. So
For sure. All right, man. Well, I really appreciate you taking the time. I know
yeah,
it's late. You're driving everything today. So, yeah. So where can people find more of your stuff?
Yeah, so, you know, the YouTube channel is pretty active. So just search my name, Gary Linkov, it'll come up, or the practice name. The practice is City Facial Plastics. I'm the only doc in the practice, but I decided when I started it to just kind of have a name that's separate from like my name, just for the future, and just, I don't know. That's just the way I did it. So yeah, so we always have both present. Instagram at Dr. Gary NYC, and then my website has, people forget about the website. You know, they go and they're like, oh, how come you only have like 3 pictures? It's like, did you see the gallery like on the website? cityfacialplastics.com. That's like, you know, has everything, and that all of our contact is on there. So it's not hard to get in touch.
Okay, awesome, man. Thank you. Well, I'll have your YouTube, Instagram, website, and the link for Operation Smile down below.
Thanks so much. And I look forward to collaborating more in the future, Dave. And, you know, we'll do something fun.
Absolutely.